again. My name is Dr. Maya Edgar and I'm a chiropractor at Edgar Family Chiropractic. Just as a follow-up to one of our earlier videos about what a chiropractic adjustment is, we feel that it's very important to explain that there are different types of adjustments. Most people, when they think of chiropractic adjustments, they think of the, getting into position, moving a body a certain way, and the chiropractor is applying pressure, after which they hear a crack or a pop. This is what we call a manual adjustment, and this is the majority of adjustments that are usually done. However, there are different types of adjustments, and there are adjustments that are a little bit less forceful, depending on the size of our patients. Our patients range from babies to people who are sometimes 99 or 100 years old. So they have different needs and different wants. Some people are not comfortable with the regular adjustment. If we're treating a child, we're not going to be using a lot of force. And so we have a way to adjust using an instrument. For instance, this is one of the instruments that we use here at Edgar Family Chiropractic. It's called an impulsor. And what I want to do is I want to just demonstrate. We're going to pretend that this is our person. This is their spine. And I just want to demonstrate as to how this instrument works. So once we've assessed and we found an area of restriction, we would then make contact like that. The instrument delivers a set of thrusts that get the joint moving and relax the muscles around the joint. This impulse instrument came out of many years of research with a chiropractor and an orthopedic surgeon who worked in the States and did a lot of research in the United States and in Europe. And what they did is they actually set the instrument up on people who were going through back surgeries. And they measured to see what would happen to the spine when this instrument applied a force. And they were able to measure very accurately how much force was needed to get the maximum amount of motion in the lower back and pelvis, mid-back, and neck. So it's a very effective tool. It allows us to get very specific on the joint, and it allows us to get motion back in the joint without having to do a manual adjustment. And a lot of people enjoy that. So that's a little tad bit on the different types of adjustments that we do. We also do very light adjusting on, let's say, babies. We may even just use the pressure of our fingers to adjust an area on a very young infant. That's sometimes enough pressure, as if putting just enough pressure on, let's say, a soft tomato before you burst through the skin. So sometimes adjustments are very light. We hope that this video was helpful in explaining the different types of adjustments that we do. And in the next video, we're going to talk about what other things we do as chiropractors besides just adjusting.